cholesterol metabolism. The topics included in this lecture are cholesterol metabolism, regulation, as well as hypercholesterolemia. So, if cholesterol synthesis is dysregulated, hypercholesterolemia may occur, and patients need to reduce their blood cholesterol levels pharmacologically by drugs. And as we know that bile acids, a great percent of bile acids is reabsorbed and recycled in the liver, where they have a great percent of the cholesterol with them, and only small percent passes with feces. So pharmacological intervention will block the recycling of bile acids and consequently forces the liver cells to utilize more cholesterol in bile acid synthesis, and this will share or contribute to the lowering of cholesterol levels in blood. The examples of these bile sequestering agents are cholesterol and cholestyramine, which are anion exchange resins, and as mentioned earlier, they act by blocking the intrahepatic recycling of bile acids and thus forcing the liver to utilize more cholesterol in sense of bile acids, and this will contribute to lowering of blood cholesterol levels. The bile acid sequestering agents are used in combination with other drugs, which are the statins, and statins are hydroxymethylglutarate-CoA reductase inhibitors. They reduce activity of the reductase, which is a regulatory enzyme for cholesterol synthesis, and this gives better results in treatment. As mentioned earlier, if dysregulation of cholesterol bile synthesis occurs, hypercholesterolemia may occur. An elevated cholesterol level in plasma above 220 milligrams per deciliter is considered as hypercholesterolemia, where the normal range lies between 150 to 220 milligrams per deciliter, and hypercholesterolemia, as we said, results from dysregulation of the mechanisms of cholesterol synthesis. This disorder may be familial or secondary to a primary disorder. The familial type may be due to a deficiency of the low-dense lipoprotein receptor, and this is a genetic defect of the low-dense lipoprotein receptor gene. And as we know, the low-dense lipoprotein receptor is responsible for internalization and uptake of the low-dense lipoprotein with its cargo of the high cholesterol content. Other causes or secondary causes of hypercholesterolemia include carbohydrate-rich diet, which provides the substrates for cholesterol synthesis. Carbohydrate provides acetyl coenzyme A and reduced NAD phosphate for the synthesis of cholesterol. A second cause is diabetes mellitus, where the lipid and all other types of metabolism are disturbed. The low-dense lipoprotein protein receptor and its metabolism are deranged in diabetics. And there is decreased clearance of the plasma lipoproteins, especially the low-dense lipoprotein with its high content of cholesterol. A third cause is hypothyroidism, and it is known that thyroid hormones stimulate bile acid synthesis from cholesterol. So these cases are associated with hypercholesterolemia and maybe gallstone formation. Other causes maybe some types of obstructive jaundice, which leads to decreased cholesterol secretion through bile ducts with bile acids. Also, obesity and nephrotic syndrome cases are associated with hypercholesterolemia, but the causes are unknown. Clinically, hypercholesterolemia may be manifested by hypertension, atherosclerosis, or atherosclerotic problems presented by myocardial ischemia. Other presentations may be with cases of hypothyroidism and their complications, skin manifestations as xanthomas of the eyelids, or eruptive xanthomas associated with hypertriglyceridemia. Also, it may be detected by routine laboratory investigations. How to treat hypercholesterolemia? The first line of treatment of cases of hypercholesterolemia are the lifestyle changes and dietary regulation. Also, pharmacological treatment by drugs as statins, which are hydroxymethyl-butyrate-CoA reductase inhibitors. These drugs are structural analogs of the hydroxymethyl-butyrate-CoA, which is a substrate for the enzyme, and thus inhibit cholesterol synthesis and reduce intracellular cholesterol. This will consequently lead to low-dense lipoprotein receptor synthesis upregulation and increased uptake of cholesterol. And this will finally lead to lowering blood cholesterol level as we reduce intracellular synthesis and increase uptake from the circulation. Another agent is niacin, or nicotinic acid, which has a minor role in treatment of hypercholesterolemia due to its side effects and complications. Also, we have the oat bran, which are the soluble fibers of oat. These fibers bind bile acids with their cholesterol content, and this shares in lowering cholesterol blood levels. Other drugs used, as mentioned earlier, in combination with the statins are the bile acid sequestrants, or bile sequestering agents, and their examples are cholestyramine, cholesterol, which sequester bile acids in the gastrointestinal tract and block their recycling. But these drugs also block absorption of fat-soluble vitamins. They may also bind some polar drugs as warfarin, digoxin, and thyroxine. So they have many side effects and drawbacks. So the best strategy for treatment will be the soluble fibers and the statins, as well as lifestyle change and dietary regulation. The last topic in this lecture is hypocholesterolemia, which is decreased level of cholesterol in blood below the normal level, which is 150 as a lower limit, 150 milligrams per deciliter. Some of the causes of hypocholesterolemia. First is a hyperthyroidism, which is a common cause for hypocholesterolemia. Other causes may be pernicious anemia, hemolytic jaundice, malabsorption syndrome, and other causes that will be discussed in a separate lecture. Thank you. You can find other relevant information about this lecture and other lectures at this site.